joining you from the Cal State East Bay campus, where teach. Just a gentle reminder that if you are not speaking, to mute yourself, and that way we are listening to each other as clearly and as possible. So tonight's listening session, it's a listening session, it's not a town hall nor a bidders conference. This listening session is intended for you, the community partner. Right? So we're here as the capacity of the public health department and the county to listen and to document your ideas and your feedback. You may recognize some folks in the group, right, as folks from the county, from staff who are joining us, and we're asking county staff and our county folks to kind of sit back and just join us as listeners, if you could please. And so this is an opportunity specifically for our community partners to share your thoughts on two specific topics. One, which is capacity development, and the second, which is resource navigation. And we know that many of our communities are still, we talk a lot about the pandemic being done, but we know that many of our communities are still struggling for resources, and their needs still need to be met in order to continue taking on this challenge that has been presented to us all, right? So for tonight, we won't be answering any questions. There will be opportunities for folks to be in conversation and to be in dialogue. What we're going to be doing is where we will be able to provide answers to some of those questions. But tonight, more than anything, it's for you to share and for us on the county side to listen. And so with that said, I want to kick it over to our wonderful Director of Public Health, Kimmy Watkinstar.
Thank you, Nestor. And it's wonderful to be here and see so many of you here to provide us with your perspectives on how we should be thinking about outreach and resource navigation and capacity development. My role here tonight is just to provide an overview of the American Rescue Plan Act, very brief, concise overview, and the rest of the session will be facilitated by my colleagues, Nitu Balram, and then Nestor Castillo. Next slide, please. So many of us know that this funding source really came about in March of 2021, and ARPA, or the American Rescue Plan Act, was signed into law, which provides quite a bit of money, $350 billion of additional funding designed for state and governments to support public health expenditures around COVID-19 mitigation efforts, address economic impacts, including economic harms to workers, households, small businesses, industry, and public sector, serve the hardest hit communities and families. It was also intended to replace lost public sector revenue to the extent due to the pandemic, provide premium pay for essential workers, invest in water, sewer, and broadband infrastructure. Next slide. The funding categories or funding priorities that have been laid out are very broad: equity, workers, community engagement, and evidence-based interventions. Next slide. With all of that in mind, our Board of Supervisors has identified its priorities for the use of the ARPA funding for Alameda County for the first tranche of money. $162 million was the first half of $324 million, which was allocated to Alameda County. The slide in front of you shows how the Board of Supervisors has allocated those resources. 50 million went to Alameda County Healthcare Services Agency for the continued provision of COVID testing, contact tracing, vaccination, and other needed mitigation services. Another 50 million was allocated to the Social Services Agency for the continued provision of emergency food and other basic needs throughout the county. 14 million was dedicated to highly impacted communities, families, and businesses in the urban unincorporated area of our county. And the last bucket, which is around $48 million to highly impacted communities, families, and businesses in the following areas: capacity development for 10 million, outreach and navigation at 5 million, economic development, 10 million, and community needs grants, 23 million. Next slide. So our conversation tonight is really about the portion of the funds that the Board of Supervisors has asked the Healthcare Services Agency to administer. And this is 11 million of the portion that I identified at the bottom. 6 million from the capacity development pot to expand on the agency's community coalitions, and 5 million for outreach and navigation. Next slide. And now, and I recognize that this was a very brief summary. We can make this information available to you so that you all have what the different allocations are. My colleague, Neetu Balram, I believe, is up next.
Thank you, Kimmy. Can we go to the next slide? So some of you may know me as the Public Information Manager for the Public Health Department, but just introducing myself again, I'm Neetu Balram. So again, I want to emphasize the purpose of today's listening session. It is to gather community perspectives, really listen on how Alameda County American Rescue Plan Act funds should be allocated. So the two categories, to go over it again, is capacity development and community outreach and resource navigation. So those two come together. I do want to emphasize again that we won't be able to speak on any tentative or specific plans for procurements. We can only really share publicly available information about ARPA funding. So that's the information that Kimmy just went over. And then the information, the feedback that we received today is collected to inform those future procurements. So we expect that more information will be available to share in the coming weeks. So can we go to the next slide, please? So just to ensure we can have a productive listening session, just some standards for us to follow so we can have a session that's productive for everyone. You know, we want folks to raise their hands before speaking. So continue to please keep yourselves on mute until I'll speak your name based on hand raising. We want you to draw from your experience, whether that's personal or organizational. Please reflect the needs of your clients if you serve clients. Please be honest. We do want this listening session to provide us with honest feedback. Please stay focused on the questions at hand. We're going to have some guiding questions for you all in the next couple slides. And please be mindful of the time so we can hear from other folks as we kind of move through those questions. So we might prompt you to keep your comments shorter. We might move you along. We don't want to be disrespectful, but we do recognize that while the amount of time that we have feels long now, if folks have a lot of things to say, the time might slip by us. So please, as much as possible, be mindful of that time. So just a reminder, the information in the chat is actually only visible to hosts. So you're welcome to use that, but you won't be able to use it to communicate with other participants in the listening session today. So with that, let's move on to the next slide, please. So for the purposes of our listening session, again, we have some guiding questions. The first one is on capacity development. So broadly speaking, what does capacity develop mean to you? There's some other questions on here that might prompt your thinking, and we'll run through them if necessary. But again, what does capacity development mean to you? We're starting the listening session, so please raise your hand. And I see one hand. And David, please go ahead and unmute and please share your thoughts.
Thank you. Good evening, and thank you for this opportunity. My name is David Harris. I'm the president and CEO of the Urban Strategies Council in Oakland. We are both participants and anchor organization in the Oakland Frontline Healers work, as well as the Sierra Health Foundation's door-to-door knocking campaign for COVID awareness and promoting vaccine development. Part of the reason Sierra Health Foundation came to us to support this work was that we are helping actually 5 local organizations, the Building Back Our Neighborhood organization in Oakland, the Hoover RAC, Village Connect in San Leandro, Padres Unidos, and an organization in Union City, who originally qualified for these funds for COVID relief and recovery. However, the organizations didn't meet some of the stringent financial requirements that the federal government placed on the COVID grants. So the county health department and Sierra Health Foundation reached out to us primarily because of the insurance requirements that these organizations had to meet. In addition, the Oakland Frontline Healers is an emerging and valuable community-based organization that is not a 501c3 that needs development. And those are the people who are at the front line of addressing the COVID crisis, both those who we work with in the DOOR Collaborative, as well as the Oakland Frontline Healers. These are the credible messengers. These are the people who actually know individuals and communities who can help address issues of both COVID vaccination, getting COVID vaccinations, as well as addressing education throughout the county. Unfortunately, many of these organizations don't have even the general operating support funds that are needed to help support their capacity building and development. They need help in social media outreach and messaging, also in building up their administrative structures and other areas that are required for capacity building, including governance structures, as well as other items. And I encourage the county to think about those who are on the front line, those who are knocking on door-to-doors, who are the people who are really entrusted by communities to share information and can really change some of the behaviors that we hope to seek in terms of getting increased vaccination levels in our community. Thank you.
Thank you. Up next is Caroline Johnson. Go ahead and unmute.
Thank you so much. My name is CJ. I'm the CEO of the Black Cultural Zone Community Development Corporation, and we are a proud partner of the East Oakland Black Cultural Zone Collaborative, part of Oakland Frontline Healers, part of 40 by 40 as well, and many other collaboratives. And we were able to do a lot of new things to really support neighborhood messengers on the block, trusted messengers to reach out and connect and build community, to pass out PPE, et cetera. And I think capacity building, the scope really ranges not just with the organization and their team from a capacity around administering these contracts and being able to deliver the kind of results that we need, the staffing up. I think the capacity is really around health and wellness for the staff. It was quite a run. It's not over. And so I think we need to find ways to support organizations who are out there doing the work, their team and their staff, building their actual technical capacity as well as health and wellness capacity. I also think it's important to the folks that we work with, the folks we subcontract to. For instance, we contracted with over 150 neighborhood messengers, their capacity. They stepped in to do work in this pandemic that they'd never done before. And they're looking to grow. They're looking to expand their community capacity and to do more for their neighbors. And I think building their capacity technically, as well as supporting them financially to do so, is important. And then I think the capacity of our community that we're reaching out to. There were many challenges and problems that we heard that we could not solve with just passing out, you know, a mask or gloves, but sort of some of the real issues that they're dealing with and their ability to navigate and resource navigate and supporting those folks to get access when removing blockades. So I feel like capacity covers the organization and their team. It covers the subcontractors and the folks who are on the front line, and it also relates to our capacity. So those are the folks who I think should be involved in capacity development. And in an ideal world, what would capacity development look like? It starts with community building and the coming together. We have been through a lot. So health and wellness, food, meals, gatherings to really let people rest and relax really is going to be important, because we've been through a lot and folks have just been moving, you know, like it's nothing, but it's been 2 years of being on lockdown. So I think that really saying that health and wellness and behavioral health and support people are going to be coming out of the shock of the pandemic. What are we going to do to build their mental health and wellness capacity, as well as the resources, the management of those resources to deliver those things effectively? So how would one know that capacity development is working? That is a great question. I think you have to hear directly, really truly have an unfettered access to the community to tell you what is working, to tell you what is not. So it's important that folks who are again on the front line, that have direct access to the people, to the neighbors, and to those folks who are most affected, have a communication ability to gather true data from their voices, true data from their access, true data from what their needs are, to get that back. But the key is not just to get that information back directly from the source, but that we can rapidly adjust and respond to additional needs. And I'll end with this one example. We passed out lots of PPE, gloves, and masks, and folks needed water. Folks needed food at different points. They needed a bus pass. And so having some flexibility in the funding to be able to rapidly respond so that we don't have to modify a contract to say, well, instead of this, we're going to do this, but giving us the ability to have a wider range of things based on one block may need this, one neighbor needs that. So that flexibility is going to work. And I think, how do we know capacity development is working? Again, it's pre and post testing. How are folks feeling now? What do they want? And how are you getting that information on how they're feeling about the quality of their life going forward? Thank you.
Thank you, CJ. Jane Lee, you're up next. Please go ahead and mute.
Hi, my name is Jane Lee. I'm the program manager for Oakland AAPI Unite. It is a coalition of about 14 organizations. So for me, on behalf of OAPU, I'd love to share that the scope of capacity development, I believe, bleeds into actually the second question of who should be involved. And I think that it can actually involve any organization or people who have a relationship and a desire to build and learn from each other, or even organizations or people who, you know, through external reasons have not been able to build relationships with each other, but could learn from each other's expertise. I think this is how coalition building and impact could work. I think a very specific example of that that's relevant to ARPA funds is, okay, if we have smaller organizations who don't have the capacity to go through the grant writing process, to understand kind of the fine print that goes through a grant that is coming, or dollars that are coming from the federal level, but they are in community and relationship with a larger organization who has the capacity and the knowledge to do that, then instead of just having one lead organization kind of do that whole process and distribute the monies, that's going to perpetuate the problems that we keep seeing. So if they have a relationship, let them work together. And I really want to highlight what Carolyn was saying around not just the technical aspect, but the health, wellness, and the joy, and which we know that if we're joyful and have transformative relationships with people, we can sustain the work that we're doing for longer periods of time. So it's both financially supportive and relationally supportive are two aspects that are important for capacity development. So back to the example is, if you have a larger organization, they have a relationship with a smaller organization, get the two accounting people from both of those organizations to work together to help the smaller organization understand the process of getting the funds, whether it be from federal or county or state, but pay those people to do that work. And I think to get to the fourth question here of how would you know that the capacity development is working is to ask the people, hey, did you not know how to do this before? And do you know how to do it now? And how has the capacity within the individual grown? Or asking the organization, hey, with these funds, who did you hire and how did that expand your organization's capacity to do this particular thing? So I think that example is kind of getting to question 3 of in an ideal world. I think it looks like organizations working with each other. And I think that in and of itself could solve a lot of undergirding issues that are happening as well. So I want to end with that. Thank you so much.
Thank you, Jane. Leah Spellman, go ahead and unmute. I do want to note we only have a couple hands after this. So if folks want to speak on this question, we invite you to raise your hands and we'll definitely have time to get to you.
Thank you. So my name is Leah. I'm the Executive Director for Partnerships for Trauma Recovery, which is a nonprofit in Berkeley providing mental health care to refugees, asylum seekers, and international forcibly displaced people who are now residing in the Bay Area broadly. So I think for us, for capacity development, I loved what CJ said about just kind of needing to look at not just technical capacity, but also the health of the organization. And also what David was mentioning about the different types of positions that may traditionally be a little bit more difficult to fund. So for us, capacity building means being able to use dollars to support positions like grant writing and HR, because these are not only in support of operations and direct services, but they really do support the health of the organization as a whole, whether that be financial health or the culture and the health of the people. I think there are other really amazing positions coming out more that are more visible in large foundations or companies like Chief of Equity or Chief of People. And I think that especially because we as organizations have been on the front lines and have been asked to hold space and provide services for folks who otherwise wouldn't be able to access services, it is a lot to do this work. And I think we're all kind of, well, I'll just speak for myself. We're definitely looking out and saying that we could use more help for the helpers. So when I think about capacity building, I think about how can we structure organizationally, how can we support additional positions that are dedicated more internally to helping build that culture and those systems and processes and structure. So who should be involved in capacity development? I think one other thing that we would love to have capacity building dollars for is continued strategic planning. And I think that also that should really involve communities. So having time and space to elicit feedback from community members about both short-term and long-term programming and what they want to see feels really important to me. And I think that goes into the last question of how would one know capacity development is working? So I loved what Jane said. And then I also think that just asking communities, is organization X providing programming that's meaningful to you and that aligns with your needs is really important to know if we've succeeded. So yeah, thank you.
Thank you, Leah. LaJohn, you are up next. Feel free to unmute.
Hello, thanks for the opportunity. My name is Lejon Loggins. My capacity as of now is violence interrupters under the BALLS program, Department of Violence Prevention. My main concern is that I would like to be considered up under the capacity development and building would be the after effects of being in COVID and different crimes that has been taking place within our community, like robberies or shootings and different stuff like that, mental health. So I would like to just bring within a conversation funding for the consideration of the different types of crime that's been affecting our community after COVID and a different uprise of crime within our community and a many different types of mental health and things that we have to deal with as violence interrupters within the community. So that's all I want to bring in a conversation. And I hope that Alameda County is allocating funds to deal with that type of help within our community. That's all. Thank you.
Thank you, LaJohn. Aaron Ortiz, you are up next.
Thank you. Good evening, Aaron Ortiz, CEO of La Familia. Great to be here. No, I think CJ and Brother Harris, Jane Lee and others definitely hit a lot of good points. So for me, when I'm looking at this, it's a pot of about $10 million from what I saw. And I think the key is to make sure that it's really being allocated proportionately throughout the county, and that, areas that are highly impacted by COVID that may not be receiving the resources that they need, that should be properly resourced would be the key. So whether it's East Oakland, whether it's Brazil and Fruitvale, and I'm not only here speaking on behalf of La Familia, I'm also here speaking on behalf of Brazil and Fruitvale, which I'm a member of, and we have other members here today. Having a focus on the undocumented community that is not going to have resources to them now when it comes to what's happened with the recent law that just took place about 2 weeks ago. That's going to be a key right now to make sure that some of those resources are funded. And what I would say, whether you're looking at a grassroots organization or community leaders, you really want to evaluate how you fund organizations that traditionally not only have not been funded, but have not had the opportunity to maybe have a fiscal sponsorship, or to maybe have funds because they're not only a 501c3, but because they're not incorporated. So I would urge you to give those organizations some of the possibilities up front first, and have someone be their fiscal sponsor, but just provide guidance, not necessarily just in a leadership role. Give some of those agencies that haven't had the capacity the opportunity to lead through this capacity development opportunity, is what I would say. So I would pause there.
Thank you, Aaron. Going on to another Aaron, Aaron Scott.
Thank you. My name is Erin Scott. I'm the executive director at the Family Violence Law Center in Oakland. We serve the whole county. I have a couple of things I want to say about capacity development on behalf of the larger community of folks who are focused on serving survivors of gender-based violence. One, I would just say is that before the pandemic, our services were not to scale, in terms of the capacity of all of our organizations. And there's, a healthy coalition of organizations in this county, but none of our services were to scale to be able to meet the pre-pandemic need. And the need during the pandemic has increased. We're seeing kind of across the board in our own organization, and this is within the last 6 to 8 months, like 25 to 30% increase numbers for requests for legal services, which is, one of the things. We have a team of attorneys. We've seen major spikes in requests for all services. I'm sure everyone's aware that shelter beds for the organizations that provide shelter have been full. So we're really seeing a pretty severe impact, in terms of domestic violence, sexual assault, sexual exploitation, et cetera. And again, before the pandemic, we did not have the capacity to meet the needs. So I think it's imperative because our clients, the clients who are impacted by this type of trauma, many of them, when we first meet them, are already experiencing many other issues that all get aggravated by the violence that they experience. They're already experiencing, some of them, poverty. Some of them have past trauma. Some of them were not employed, et cetera. So there are just so many issues that our clients are presenting. And we've really, even though we've received some relief funding to serve our communities, much of it has been temporary. So that actually gets me to the other big thing I want to bring up about capacity development in this context. The funding that we're talking about is great that it's coming in, but it's likely to be one-time funding or the guarantee of it continuing. So when I think about what capacity development means in that context, I'm always concerned about adding a lot of permanent staff, that we may or may not be able to afford to keep after the end of this funding. So at least from the gender-based violence community perspective, I think getting some, assessment in terms of the capacity that's really needed in our county to address these issues, along with, a plan from the county to put infrastructure in place so that we have ongoing support, whether it's county-based support or CBO support funded with county dollars, to take some of this money to plan, to say, what do we actually need to do long-term? It's great to get some money in the short term, but when you're talking about true capacity development, when you're talking about many of the systemic, persistent, difficult to address issues that we're all raising, one-time money is not going to fix it. It's going to be a Band-Aid. So I do think some of this money needs to go to address current emergencies, but in terms of capacity, I think the smartest thing we can also do is take a good look at what we need to do as a community to better prepare our all of our community for both non-pandemic life and also for life when unexpected emergencies like pandemics, wildfires, et cetera, when they occur. And then just the last thing that I want to say is that the public health department hasn't done a really comprehensive look from a data perspective for many years regarding issues like domestic violence, sexual exploitation, sexual assault, et cetera. And the lack of that kind of real data impedes our own individual fundraising efforts. So again, using some of this capacity development money to really look at some of the deeply entrenched issues that all of our organizations are trying to address and come up with some plans and promises to devote ongoing funds. Thank you.
Thank you, Erin. Before we go on to Anita, I do want to remind folks we have about another 11 minutes, 12 minutes or so on this question. So please do add yourself to the queue if you want to speak on this topic. Anita, go ahead and unmute. Thank you.
Hey, good afternoon. Thank you for the opportunity for this listening session and this opportunity to provide feedback. I'm Anita Kumar with EBALTC, and I'm here on behalf of the Healthy Havens Court Collaborative, which is a neighborhood place-based collaborative focused on health equity from a place-based lens, focusing on East Oakland. And so I just wanted to echo a lot of what my colleagues here or allies or partners here at the table are sharing, and then kind of add my voice to the mix here in terms of the scope of capacity development. It's really looking at focusing on equity. And what do we mean by equity? We mean looking at those neighborhoods and those communities who are most in need, who've been hardest hit by COVID, and dedicating some of those resources to those neighborhoods. It's also dedicating, when we talk about community capacity building, it's dedicating resources to a backbone team to support partners to come together in spaces like a neighborhood collaborative or community coalition model to strategically align resources and bringing those partners together and leveraging each partner's expertise so that, for example, large organizations are supporting the smaller organizations and allowing those grassroots organizations to do the work on the ground, while the larger orgs can build their capacity by doing the back end work on the operation side. It also means having the backbone team support building out a shared measurement system, which is data and evaluation, to be able to measure and track progress together collectively. Are we actually making a difference? Are we turning the curve? Are our community members actually better off based on our collective work together? Who should be involved in community capacity building? Think both large and small organizations who are in the community or in the neighborhood that you're working in, who are trusted partners and community anchors. They have the relationships in the community. The larger organizations also tend to have contracts or history with the county, so they can be that connector between the community, the smaller grassroots organizations, and the county, to be able to partner differently and communicate differently, streamline communication, and be a partner and ally to the county. How do we know capacity development is working? One, residents in the neighborhood that are most impacted are reporting greater sense of health and well-being, emotional, physical, mental. They're reporting feeling more connected to their neighbors. They're reporting they feel like they can afford their rent and won't be living in fear of being evicted by their landlord because multiple families live in an apartment because that's all they can afford. Or they report some violation of something like mold or substandard housing and their kids' asthma keeps acting up. And so the landlord threatens them with eviction. It means being not living in fear of being pushed out of Oakland because the cost of living is too much, because there is supports, social and economic supports that are being provided to better allow them to stay in Oakland. They report a safer community. They report access to healthy food on a regular basis, so they're not living in fear of whether or not they have to make the choice between paying for rent or for paying for food on the table. Secondly, we know capacity development is working when organizations together in the collaborative report the benefit from participating in this collaborative model, where they're each strategically leveraging their expertise, so the partners on the ground are able to focus on doing the work that meets the community needs. They're saying, oh, I'm doing the work that I need to be doing on the ground, rather than worrying about sustainability or having to do the reporting on a regular basis that I'm not having time to actually be out in the community and serve the community in need. It means partners are reporting strength and trust among one another, stronger communication. They're not fighting or competing for resources, but working together to collaborate more. This is how we know capacity development is working. Thank you.
Thank you, Anita. So again, we have until about 5:51. So if you have any comments you want to make on this question, please add yourself to the queue. Sharon Cornhue, if you want to go ahead and unmute. And then after that, I'm going to read a comment that we received in the chat.
Great, thank you. I'll try to be very quick. I want to associate St. Mary's Center with the comments of prior speakers about health, wellness, and joy, and building the capacity of organizations to care for those who care for others. Really important. a lot of this comes down to what working moms have always called cooking for leftovers, right? You're making a meal and what's left over, that's capacity development, building some muscle that's there later on. And I want to talk about 4 quick things. Partnerships, part of what St. Mary's did through the emergency food distribution program was bringing new resources to partnerships that had existed before to deepen them and to make them stronger. We looked at responsiveness and flexibility mentioned by prior speakers, to be able to be nimble and to pivot from shelter to permanent housing, for example. We looked at resiliency and focusing on prevention. I love the comment someone has made about, I wish we didn't have to be as resilient, right? And finally, I think what's critically important for developing capacity at this time is advocacy, the leadership of those most impacted to be leading the discussion, performing the evaluation, and advocating for ongoing work as opposed to one time only. Thank you very much.
Thank you, Sharon. So before we keep moving along, I do want to read a comment that we received into the record. So capacity to support Medi-Cal expansion to the undocumented, capacity to support Medi-Cal renewals. Thousands are at risk of losing their Medi-Cal benefits, and supporting those who are still eligible is critical for continuity of care. So thank you for that comment. I do want to note, Susan Zhang, I believe you had your hand up and may have taken it down. We do want to give you a chance to speak if you wanted to take this opportunity. So if you are still on and want to speak, please go ahead and unmute. Okay, so we will continue to move along. We do just have a couple more hands. So Diane Lewis, please go ahead and unmute.
Good evening. My name is Diane Lewis, and I started a community-based organization out of my Love for community. Black Brain Ventures, we do program management and technical assistance and outreach assistance to help the larger organizations reach those neighborhoods. But I'm concerned more so with the youth that in the last 2 years that have lost what they consider a lot, 2 years out of a teen's life. And in an ideal world, I would put youth as a specific stakeholder to assess and make sure that they are getting what they need out of this, all of these resources. They've lost a lot. I mean, literally between rent being too high and school closures, there's a tremendous need in the youth community in at least, well, I'm in Oakland. So I'm looking at them as very knowledgeable about their own needs of wellness and health as they go into the fall and over the summer. I would look at them as a specific stakeholder in this whole discussion and having their own voice in what and how the money is spent. Thank you.
Thank you. So we have just one hand raised left. Lizandra, please go ahead and unmute.
Good evening. My name is Lizandra Dial. I am formerly with the City of Oakland, the Executive Director of the Oakland Workforce Development Board, retired and now doing consultancy, basically helping nonprofits increase their capacity. So my contribution this evening is more so from the perspective of the procurement process, having managed some of the CARES Act fund. And we looked at an equity lens and really wanted to put funding in neighborhoods that had not received funding, that were under-resourced. And oftentimes there's organizations in those communities that don't have the infrastructure. And I think that David mentioned this earlier, like insurance and able to actually manage the grant. And so oftentimes they're spending so much time trying to figure out how to manage a contract. Government contracts are they're not easy to manage. And so to the extent possible, if the county can provide some type of maybe workshops or ongoing workshops of how to do business with the county, how do you get insurance? What is insurance? What are some good insurance providers? Reporting and templates and things like that that really helps them from that perspective, because it is one-time money. If they're able to build their infrastructure, it puts them in a better position for other funding streams that may become available. And so I'm really talking about the organizations that really haven't been funded, right? And of course, as some others mentioned about the backbone organizations, fiscal sponsorship organizations, making sure that they also are properly resourced so that they can provide those supports to build up those other organizations. We want to see more funding in the neighborhood so people don't have to leave their neighborhood, and oftentimes they're having to go out to certain neighborhoods, especially in Oakland is where I was working, that they would have to leave and maybe come downtown Oakland for those type of services. So, and also from a county perspective, in as much as possible, if looking at any policies or procedures or legislation that may need to be adjusted, may be tweaked, maybe, we're thinking something is actually a policy and it's made more of a practice to make it easier for someone to get in. So doing that pre-work to see what can we do to allow, I know that we have to have insurance. Well, is there other things we can do? Are there other reports? What can we do, or what can you do as a county to help support an organization to have a strong, solid foundation so that they're able to apply for this funding and any other funding that may become available in the future? Thank you.
So Lysandra, thank you so much. I do note that there's a couple more hands that were raised. We do want to move on to the next topic to give a little bit, equal time to that question as well. So Carla, I don't know if you wanted to speak on this topic or just queuing up for the next one, but I'll go ahead and mute. We do ask that you be brief if possible so that we can give equal time to the next topic.
Thank you very much. Yes, I'll try to be brief. My name is Carla Guerra. I'm representing Resilient Fruitvale and the Unity Council. And as an immigrant myself, I just want to echo a lot of what my partner organizations are sharing, in the scope of capacity development should really focus on advocacy and equity, serving the hard to reach communities that have been historically marginalized and continue to be marginalized by structures and systems like BIPOC, monolingual immigrant communities, and undocumented community members who shall be involved, anchor organizations and neighborhood collaborative models and coalitions that have the relationship and trust from the community members. They are very knowledgeable on the needs of their community and culturally competent as well. Thank you.
So before we move on to the next slide, I did want to note, and I'll do this again before we close out, you can send us comments at publicinformationoffice@acgov.org. If you go to bed tonight and something pops into your head, or if you would feel more comfortable putting your thoughts in writing, please utilize that opportunity. I'll put the email address in the chat. So if we can go on to the next slide, please. And I do want to thank everybody who did speak on this topic for providing your comments. So this next discussion question is about the area of community outreach and resource navigation. Those two, I do want to note, are combined. But you'll note that we are asking in this set of questions, should these activities be a combined function as they're listed, or are they unique? As I did at the very beginning of the last question, what do community outreach and resource navigation mean to you? But there are some guiding questions there on the screen that can help form your thoughts. So feel free to use those to provide us with your feedback. So I have my first hand. Carolyn Johnson, go ahead, and then just folks, please do raise your hands. Keep yourselves on mute until I speak your name. Thank you.
Thank you so much again, CJ. I'm CEO of the Black Cultural Zone Community Development Corporation.
Thank you, CJ.
And we have done quite a bit of outreach and navigation support as well. I think that they are distinct. So community outreach is really a lot of some of the things that we're doing with neighborhood messengers and other folks are doing with frontline healers and credible messengers, all of those things, that credible folks who can really connect with the community in a broader way. And so reaching out to them where they are, bringing them information and resources in ways that work for them in their language, with the tone and the beautiful colors of the folks who are there. All of that is outreach to get to them and to reach them, and then to bring them in to get access to the resources that are there and to help them navigate is a very distinct function, because it takes someone who is making sure that the resources are current and valid, et cetera, and making sure they get connected to them. Then I think there's a third function as well, which is called that retention, right? So we can send someone over to this particular place, but did they stay? What's going on? What's happening? And so I think that there are actually three unique functions. I would not combine them. I think they're distinct, but should be connected. Some groups are better at others and should be in that queue, but it should be brought together under one umbrella. We want to find people where they are, get them to what they need, and make sure they actually use those things and they work. And to have a feedback loop. So if they're not working, there's different things for different neighborhoods and communities, we're all in the loop together. So who should be involved, again, are credible messengers, folks who have all of the resources, who sit in the middle of those resources. And in an ideal world, what would it look like? It would look like we are resourcing people at the block level and at the community level that are credible, giving them all that they need financially, information-wise, technical-wise, so that they can easily answer a question from someone. Hey, where can I get a library book or a library card, whatever that might be? And they are connected. We need to have those organizations that they are connected to, given a unique number or a way for them to get to them quickly and fast, and give them the resources to make sure they can respond rapidly. And how will we know it's working? Really is at all levels. How many folks are we reaching, and are we reaching them effectively from both the community member side as well as the folks who are reaching them and what they're hearing? Those resources that we navigate them to, who's coming in, what are they asking for? Is it the right kind of referrals? And then ultimately success. And what will success look like is that our community members get what they need, are able to stay in place, are able to have a high quality of life. And if we don't have the kind of resources that are they're looking for, that we have a way to rapidly respond and be flexible and get those resources to them. Thank you.
Thank you, CJ. I do want to know, we just have one hand, so please, if you do want to speak on these questions and give us your feedback, please raise your hand. Go ahead, Aaron.
Thank you. I would, in this particular area, give organizations the ability to be creative. We do testing and vaccines across the county. And we partner with organizations like Street Level and Homies Empowerment, Tribe, and others. And I got to tell you, some of our biggest clinics have involved food. So when we're doing community outreach, we're giving different modalities, if you will. We're doing outreach, we're doing food, we're giving you vaccine, we're doing different functions. Now, when it comes to resource navigation, it can be one and the same, but it is separate, as CJ said. Really getting people to the services that they don't have access to. And I think with that, again, organizations that apply for this, I would, from the county's perspective, give them the ability to be creative and measure it in a way that they are connecting people to services. So I'm less trying to parcelize it to one particular delivery type of a system, but more just open it up for the whole system to be creative in their own way. How we as La Familia, does resource navigation for the Latino population in Spanish with translation may look another way for another population. So again, the ability to be creative. I'll pause.
Thank you, Aaron. Cheryl, go ahead and unmute.
Good afternoon, good evening, everyone. I concur with everything that Aaron said, and especially with what CJ said. And I just want to really make a strong emphasis on the need for resources for trusted messengers. It's imperative. And I think that we do a disservice by coming from an agency and saying, this is what needs to be done, as opposed to listening to those who are on the front lines who have the knowledge of exactly what's going on in the community, and particularly know members of the community and neighborhoods and have listened to their needs. So I think that the outreach portion is multifaceted. It is with the community messengers. It is also with, I think something CJ mentioned earlier about having even some groups and with in the neighborhood, if there are neighborhood meetings, something along those lines, so that you're able to hear what the people in the community are saying and what the needs are. So ultimately, I would definitely say it's the trusted messengers that are key, and it's they come with the cultural competence as well for specific needs. It is not just all thrown into one basket, but it is it's very unique, as in the question you asked, should these activities be combined function or are they unique? They are very unique, and we need to be sensitive to that. So I would definitely, for the third time, say, I think it's important to make sure that there is funding and resources available for trusted messengers and for those who are on the front lines in the community. Thank you.
Thank you, Cheryl. Gabriela, yeah, you are up next. Please unmute.
Yes, thank you. Good evening, everyone. Gabriela Galicia, Executive Director of Street Level Health Project. I definitely agree with everything that is being said. And I want to first start off to say, like, there is not a one size fits all approach with outreach. We need all types of ideas, innovative approaches to be able to do this work and to meet community where they're at. I think one thing that we as Street Level Health Project value is really going on the ground. That's why our name is Street Level, right? Going block by block, talking to people on the street and meeting them where they're at. And a lot of times it's not a flyer. A flyer is not going to feed someone. It's not going to give them the services that they need. It's that relationship building with the person behind the flyer that is going to support them and provide them. And a lot of times we're the first point of contact, right? Meaning that for some of the community members, like the communities members that we serve that recently arrived, they don't know how to navigate the systems. They don't know what services are there for them. And so we are those first point of contact for some of those community members. So we have to remember that outreach and education is great and it's important, but more so the navigation piece, and to be able to have those services, that really means then having also funding that goes towards those services. We cannot go as outreach workers out to the field and say, yes, you know, we're going to give you a list of paper with these services, but they're not there the next time they want to access them. A good example is of the food contracts, right? When those food contracts went away, a lot of people started to come to Street Level asking, where can I get food? You guys are the only one of the few people still operating the way it was being operated. So I want to say that that's a really key thing. And going into the neighborhoods, being able to talk to people, being able to relate with people. People were very isolated in this pandemic. And a lot of times just being able to talk to someone for 1 or 2 or 3 minutes really made a difference. And a lot of what we're hearing now is there's a lot of stigma, a lot of mental health support that is needed. And so how do we as outreach workers provide not just the information of where to get these resources, but help them navigate, and at times even help them support them to these services, whether it's transportation, language access, and many other things. So that's what I can share from our experience of doing outreach and education and moving forward, how much more support is needed for communities at this time.
Thank you, Gabriela. Go ahead and unmute Kim Johnson.
Hi, good evening. Kim Johnson, CEO of Bananas. And I definitely believe they're distinct, but they're also, coordination between the two is very much needed. And I also believe that as far as resources, both need to be very well resourced, but also, you know, I always like to think of from the community standpoint is that there's no wrong door. we make our community go through too many hoops to access resources. So being to have a very resourced, or I should say funded and rich and comprehensive resource navigation that's available. So there's no wrong door where they're going, if possible, and echoing everything that people have said thus far. And what I would like to add to that, in the ideal world for me, is that it's to the point that CJ mentioned, you navigate and you send people to different places, but what's the closed loop? How do we know that they have in fact gotten the services that they need, that they're still retained by organizations or the services that they were referred to? We're in Silicon Valley, where technology is rich and abundant, and why can't that be leveraged so that we can make sure that we're able to make sure we're closing the loop, and that also, more importantly, we're not having our community re-traumatize themselves time and time again to demonstrate their eligibility for different services. We should be able to have people come in and get the services they need, but without having to do it and say it over and over again with every organization they encounter. So that's it for me. Thank you.
Thank you, Kim. We did receive a comment in the chat that I'm just going to read into our record. When orgs are lacking in capacity, the total weight on the navigation outreach team becomes multiplied. Resources which supply living wages for on-the-ground messengers is more than essential. So thank you for that comment. So next up is David Harris. Please unmute.
Thank you. The outreach, I'm going to just go straight to answering the questions. The outreach and navigation functions are both separate yet aligned. People who do outreach are trying to get people to access services. The navigation role actually requires a knowledge of the services that are available out there and the ability to execute warm handoffs, referrals to the people who need those services. I think that the scope is almost like right out of Mission Impossible. Do you accept the task that you're about to receive? It's about folks who are willing to go in places that no one else will go. And we learn that from the work that we're doing with the DOOR project, the Sierra Health Foundation funded initiative, which is part of also the county's Together Towards Health initiative, where people are actually knocking on doors, which combines both outreach and navigation. And so in some cases, those positions are separated. In some cases, they're combined. But in many cases, it's about going to the places where most people, including the staff of some of the nonprofit organizations, won't even go. Is it a combined function or not? Or are they unique? Well, it's combined because we're dealing with the whole families. We're dealing not with people, in many cases, just as individuals. Individuals are part of families. Families are part of communities, and we need to look at it that way. The county has a very large grant dealing with the whole family function, I believe, under the Department of Social Services. And you bring that vision and alignment to that work, and it needs to be brought to this work. Secondly, who needs to be involved? Well, or thirdly, who needs to be involved? I think many of my colleagues who have spoken and partners have discussed the role that not only CBOs in partnership with grassroots groups and anchor organizations, as well as public sector groups. And we need to get the private sector much more involved in this work. That's something that the county can help leverage to support also the capacity building goals that were outlined for the community-based organizations in the previous question. And lastly, I'll skip over the ideal world. How would we know it's working? Well, we know it's working when we're dealing with a pandemic. So we know it's working with the data that tells us that rates are going down, that people are being safe, and that's the quantitative data. But the qualitative data that we know it's working is where there are increased levels of trust between community residents in the county and the government institutions that are supposed to help and serve them. We also know it's working when we're able to get qualitative research from those people who are doing the community outreach and navigation. And I'll close with saying that at Urban Strategies Council, we work with street level health. We work with Unity Council. We work with BOSS. We work with Roots. We work with La Familia. We work with many of the organizations that have been identified, Bananas, etc., on early childhood, First Five, OSSI. All of us are looking at this from an approach of addressing the family and the community, because individuals are not isolated in communities. And if they're not part of a natural family that they come from, then they're part of the family of the friends and the folks in the community they deal with. And we cannot silo and isolate these issues. We deal with food, we deal with health, we deal with employment, we deal with education. And all of those are things that are part of addressing this issue.
Thank you, David. I do want to note that we have about a little bit more than 15 minutes left for the listening portion of the listening session, and about 7 people who have raised their hands. So I'm just going to ask folks to be concise if possible. If you support what's been said already, it looks like you can do a thumbs up or a heart, but just want to make sure people have time to give their comments. So if, being concise will help us at this time. So with that, Juliana, if you want to go ahead and unmute.
Thanks. So thumbs up to everything that's been said, and really appreciate just the thorough responses from our partners, and really value everybody's work. I was just wanting to put a plug in for the municipal responsibility that the county holds towards the unincorporated communities, and how it's been great to see more directed funds coming to the unincorporated communities, and how we would like to see more of that when it comes to resource navigation and just everything else. This is an area that we know has been historically disinvested, but it's also an area that has nothing but the county when it comes to means of support. So we would really like to see some really disproportionate investments when it comes to the unincorporated county. And by that, I mean more than we've seen before. And we appreciate the work of the Public Health Department on that end. Thank you.
Liana. Go ahead, Allison.
Hi, thank you. I'm Allison DeYoung. I'm the Executive Director of Eden Information and Referral, which operates our 211 system, which is the 24/7 information and referral line for Alameda County. And I do have just huge thumbs up to everything that's been shared so far. Particularly, I forget who said it, but I just can't emphasize enough the importance of, the getting community input, including talking to frontline staff. I have the great privilege of having a very dedicated, hardworking team of 211 staff members who, handle crisis calls and talk to people in unimaginably stressful situations, 8 hours a day, 24 hours a day. And I think that they are underutilized in terms of the input and perspective and expertise that they could share to inform this process. What I wanted to just say, I just kind of wanted to make the plug jumping on what Kim Johnson said, 211 in Alameda County is still operating in sort of the 211 1.0 method, which is somebody calls 211 when they have a need or needs already. My staff does the best we can to search our database to connect them to the existing resources, and gives them the information, and then sort of hopes for the best. And there are many other 211s and other information and referral systems throughout the country that have engaged in much more sophisticated bi-directional referral platforms. The most sort of the biggest example is 211 San Diego has a community information exchange. There are other examples, but that is really, my vision for the agency and for 211 in Alameda County, that, we can harness sort of the resource database that is maintained by EDNI and 211 and partner with all of the CBOs on this call and throughout the county to just have a much more robust referral and navigation process. It would not just be, oh yes, you need food, call the food bank or go to the food bank. It would be us sending a ping to our partner food bank who would be part of this. Hey, I just sent, John Smith to you, please be on the lookout. We would all have vantage into a longitudinal client record. There could be social determinants of health screenings. Chances are if somebody needs X, they either need Y, Z, or will very soon need that as well. I don't know if I'm answering the questions in a very cogent way, but this is a very exciting thing for 211s and for all of us on the call. So I just wanted to kind of make that point. So thank you for the time.
Thank you, Allison. Lisa Gonzalez, go ahead and unmute if you can.
Hello, my name is Lisa Gonzalez. I'm the director of, this is a very important subject. I really appreciate all the comments. I agree with a lot of the frontline staff. You guys are doing amazing work. I really appreciate all the effort and everything you're doing. I wanted to comment about something in relation to the deaf community and how we often are searching for resources and they're already at their lowest point. And so we always have to have these communication barriers in relation to language. We have an additional challenge. Although we love Alameda County, the deaf individuals who are involved, they are impacted by the shape of the program as well as the objectives and the challenges with deaf people being able to get the resources they need and really pull from them so they can have those communication needs accessible. Whether it's deaf employees that are able to help out with this, counselors throughout the county. We would like them to really start contracting with more remote interpreting so that at every event, at every announced informational resources or anything, there's captioning, there's language accessibility, there's things that are clear and readable. And and also making sure the resources are up to par and at a high level. So we only have one organization in the Bay Area that is able to provide for the deaf community. And so we are that one. Thank you for your time.
Thank you, Lisa. Jane, go ahead and unmute.
Hi, thank you so much. I'll try to keep it as concise as possible. Again, Jane with the representing Oakland AAPI Unite Coalition. Definitely thumbs upping a lot of what I've heard so far. And I also wanted to lift up that a part of community outreach and resource navigation for marginalized communities also includes cultural and linguistic competency. But not only cultural or linguistic competency, but considering who are our most marginalized communities, and do they have a trusted community org? I was kind of blown away by the former speaker and how much they were just highlighting my point in terms of the deaf community being one of those populations, and the population that I'm more proximal to through the coalition I work with or represent right now is the Pacific Islander and Native Hawaiian communities. If you were I'm all about equity, and to that point, if you were to look at just data the way that it's presented now, it may seem like or be misinterpreted that Asians are doing fine. But if you look at the data through a disaggregated lens, you'll soon see that the Pacific Islander community through the pandemic has actually been suffering disproportionately and still are suffering and dying because of actually a lack of resources and a lack of community outreach, not because of what the trusted organization of the Regional Pacific Islander Task Force has been doing. They've actually been doubling down and working 24/7 to reach out to their communities, but they are the one organization similar to the speaker we just heard, who is really working to provide information, building relationships, building trust, COVID tests, vaccinations, to make sure that their people are literally surviving. And part of the work to tap back into capacity building also is that, how did we know that the Pacific Islander community was struggling? We had a larger organization like Asian Health Services who was doing the back end work of disaggregating that data to see what was happening, and then providing a lot of what their resources to that organization, the Regional Pacific Islander Task Force. So that's truly working in community to save lives and to engage in community outreach and resource navigation. So I just wanted to lift up trusted community organizations and cultural and linguistic competency as one. And to answer that last question of how would one know that community outreach and resource navigation is working, I think one is to look at that disaggregated data and really talk to people on the ground of, hey, are things going well? And not just looking at data that might be available on widespread media or even on the internet these days, to see if those numbers are improving and the quality of life of people impacted is improving. And a second story that I want to share quickly is I have a friend who is Cambodian who just moved to Oakland. He is taking care of his elderly parents, and they do not have a car. They live in Fruitvale, and they are literally stuck in their home 24/7 because they are afraid to go outside and walk around. And I think one would know that community outreach and resource navigation is working when they know how to get to another great organization, the Center for Empowering Refugees and Immigrants, to get their services. They would know who to call to get groceries. They would know who to call for community. And if you ask them, they would say that I know how to get resources when X, Y, or Z is happening, and I am happy to be thriving in Oakland. So I think that's how I would measure the last bullet point. Thanks so much.
Thank you, Jane. So for our remaining folks, if you can keep your comment to about a minute, we do actually have a hard stop at 6:30 to ensure language and interpretation access. So keep it as concise as possible. Thank you. Chris, go ahead and unmute.
Hi there, Chris Richardson, Chief Program Officer for Downtown Streets team. We're addressing individual homelessness in Oakland, Berkeley, Hayward, and some of the unincorporated areas. Really want to just give a huge thumbs up and expound upon what CJ called the trusted messengers, and Cheryl touched on this as well. In terms of outreach, with the unhoused community, I think lived experience is essential when building trust. I can tell you that when I go out and do outreach, I'm not nearly as successful as our team members, the folks that have that lived experience. To say nothing of professional, outreach folks, well-educated, licensed, and they serve an important role. But really building that trust, lived experience, and funding lived experience with this opportunity is incredibly important. We've been utilizing what we call the peer outreach model for 17 years to great success, and we really encourage those types of models to be funded as we move forward and as we try to build trust with the folks that have lost so much trust. So thank you so much.
Chris. Graham, go ahead and unmute.
Hi, everyone. My name is Graham Charlton. I'm the Director of Network Development for Unite Us. And I've really appreciated the conversation, the different perspectives, the diversity of thought. So thank you all for that. One thing I just really wanted to emphasize in terms of resource navigation, I think it's been mentioned multiple times, but looking to build a no wrong door closed loop referral system, I think a large part comes down to accountability amongst the community. Really ensuring that we build a system that each community organization has a vested interest in that greater good. I think that's really important, ensuring that like the term says, there's no wrong door. No one is left with a referral that gets unmet, or an organization that is at capacity that another organization can't fill in for that organization, for example. I think additionally, what's been mentioned about data, I think is really, really integral. Making sure that with a closed loop referral system, we have the data from the system to see what kind of resources are being utilized, who are utilizing these resources. There's lots of really, really sophisticated ways to do this, and I think exciting ways for the community to approach. And then the last thing I wanted to say is, as far as funding the community organizations, I think it's really important to consider the CalAIM and everything that's going on with community support and in lieu of services. There's lots of policy for those who haven't been exposed to CalAIM that are really pushing funds towards community-based organizations. So in terms of answering that last question, how do we know if this is working? If we can set up a system where we're tying clinical dollars and Medicare and Medicaid dollars to community-based organizations to see where someone went from a hospital to community-based organization and how their health outcomes were affected, I think it becomes a lot more compelling, a lot more justifiable for these, Alameda Alliance, for example, to fund community organizations if we can tie health outcomes to the dollars that are being invested into our communities. And additionally, it provides a much more sustainable stream for the community-based organizations to operate from. So thank you so much. I really appreciate the time.
Thank you, Graham. Selena, go ahead and unmute.
Yes, hi, Selena Wilson from the East Oakland Youth Development Center. Just very briefly wanted to address transitional age youth and the importance of focusing on that segment, understanding that oftentimes they are very, very, very newly navigating systems without the assistance of, a parent or someone experienced with this. And part of the work in our experience with youth, we think community outreach needs to include addressing potential stigmatization people may feel. So taking a look at how some of these assessments are done, how the ways in which outreach is done, the ways in which needs assessments are done, such that young people in particular are less likely to feel stigma and more likely to actually feel inclined to seek resources and do so in a way that upholds their sense of dignity. And to that end, as has been mentioned, in the same way that you want to include folks in outreach that have that lived experience, I think it's important to think about how youth can be involved in the outreach process to have that kind of peer-to-peer support as well.
And Raymond, go ahead and unmute.
Hi there. I'm not sure if I'm delivering my brief comment at the right place, because this has to do with resource allocation. I've been an Alameda County employee for about 15 years, and I worked through the pandemic. And as a community member, I'd like to see those who have kept the social safety net services going be recognized using ARPA funds. And again, I'm sorry if I'm a little irrelevant in terms of where I'm delivering the comment, but I saw we were running out of time, so I figured I would just insert it where I could before 6:30.
Thank you, Raymond. We did receive a couple comments in the chat. I want to note for folks to reserve a couple minutes of time for Kimmy and Nestor to close us out. I'm not going to read those out loud, but please know we do have them written down, recorded into the notes for this meeting. So with that, Kimmy, do you want to come back?
Yes, thank you. Wow, I want to appreciate all of you for participating in this call and for sharing all of your ideas and your perspectives. on these topics. I want to, before we close, just share a little bit of information with you in terms of what the next steps are and what other resources are available at this time. First, I'll start with other resources that are available at this time. As I mentioned earlier on in the presentation, the Board of Supervisors is going to be issuing community grants. You can go to the county's website and to the Board of Supervisors pages, and each of them will have information on the priorities for their district and the process for applying for those community grants. Second, I would like to remind everyone and share with you all that, of course, in order for these funds to be utilized, we have to use a distribution mechanism that is approved by the federal government. And so that is a formal procurement. It is our plan to have a procurement launched by the summer. The procurement process, as we know, is a lengthy process. However, there are many different ways that applicants can go about responding to procurements in order to make things easier in that process. And we will do our best to stick with the tight timeline and to also allow for the most amount of flexibility that is possible and be compliant with the federal requirements. I think those are the most important last comments that I wanted to make. I wanted to just again thank you all for all of your ideas, all your comments. You've given us quite a bit to think about and consider. And we look to incorporate a lot of what you have given us in the procurement that will come out. We will still have bidders conferences. We will still have that formal process where the RFP will be constructed and we'll put it out, and you'll be able to attend that meeting and ask questions and we can answer and that sort of thing. But again, I just want to appreciate all of the rich information you've given me and given us to help inform our thinking on this. So thank you very much. And I'd like to turn it back over to my colleague and Commissioner Nestor Castillo to close us out.
All right, thanks, Kimmy. You know, this has been, I think, a really invaluable process, especially for me, who sits as the chair of the commission and who represents community. I think as many of you all do as a community partner. If we can go back just one quick slide, you know, I think it was Cheryl who put it best, who says, you know, that mentioned that you all know what's happening in your communities, right? And that and so that sort of highlights how invaluable this is. These are just a couple of links that I think are super important that you will receive from the county that include the community advisory group. I think many of you are part of that group that meets tomorrow the second Tuesday of every month at 5:30. And then if we could go to that final slide, which is just a shameless plug for the Public Health Commission, because I want to encourage everyone to spread the word about the commission. It's a very little known commission that exists in our county, but I think it's one that plays a very important role in ensuring equity and ensuring that there's accountability as well, right? Because I think that's one of the key pieces here that we've discussed is the county is listening, and we have to make sure that our government and our providers are held accountable for what is needed. So I want to encourage all of you who didn't provide a public comment today, whether in writing or spoken comment, that you reach out and get in contact with the public information officer and provide your comment via email, especially if something was sparked after hearing some of the comments and you are thinking later tonight with dinner and something comes to you, that you please send it in because those are really important comments that we need to hear as well. Okay, thank you so much for spending your evening with us and for taking the time to share with your comments. And and for listening as well, because I know that there was folks who were listening to what others were saying and responding to those comments. I appreciate all of your participation, and I hope to see you all in the future.